Hello everybody, my name is Roxana Sirli and I am from Victor Babes University of Medicine and Pharmacy in Timișoara, Romania. It is my privilege to present to you our paper entitled What Did We Learn from a Large Cohort of More than 24,000 Patients Evaluated by Transient Elastography in a Single. As you all know, liver fibrosis is one of the main prognostic factors in chronic liver diseases. Thus, establishing its severity is very important. Of course, the most precise method to evaluate liver fibrosis severity is liver biopsy, but it is an invasive method. Thus, a number of non-invasive techniques have been developed. The oldest ultrasound-based elastographic technique is transient elastography. It is used for more than 15 years already to non-invasively assess liver fibrosis severity. The aims of our study were to assess in a large cohort of patients the feasibility of a transient elastography and also the prevalence of fibrosis stages by. Our study was a retrospective one which included more than 24,000 patients in whom liver stiffness measurements were performed by means of transient elastography. This study is performed during a 12 years period and included patients with liver diseases of various etiologies. In each patient, 10 valid liver stiffness measurements were obtained either by M probe or by XL probe. If no valid liver stiffness measurements were obtained, the evaluation was declared as failed. We define reliable liver stiffness measurements as a median value of 10 measurements with an interquartile range over median less than 30%. Even if the current guidelines do not recommend success rate as a quality criteria, we used it because when we started the study, success rate was a quality criteria, and it should be more than 60%. To discriminate between fibrosis stages, the following cutoffs were used. For F2, significant fibrosis, 7 kilopascals. For F3, severe fibrosis, 9.5 kilopascals. And for F4, cirrhosis, 12 kilopascals. As I said before, we evaluated 24,454 patients, almost half women and half men. The average age in our group was 54 years old. Regarding the etiology of chronic liver disease, most of our patients had hepatitis C virus infections, 35%. 20% had chronic hepatitis V virus infections. Almost 7% were with NASH, 5.4% with alcoholic liver disease. And also rarer causes were encountered in more than 24% of the cases, and here we included hemochromatosis, Wilson disease, primary biliary cholangitis, ascites of unknown etiology. The feasibility in our cohort was 90.7%. In 2,270 cases, we couldn't obtain valid measurements or the evaluation was failed. Liver stiffness measurements were performed by M probe in 72.2% of the cases and by XL probe in 27% of the cases. Reliable measurements were obtained in 91% of the cases with the M probe and in 90% of the cases by the XL probe. Based on transient elastography cutoff values, the severity of liver fibrosis in our group was as follows. Mild or no fibrosis in almost half of the cases. Significant fibrosis F2 in 15.5% of the cases. Severe fibrosis F3 in 8.5% of the cases. And cirrhosis F4 in 27% of the cases. The conclusions of our study are that transient elastography had more than 90% feasibility in this large cohort. Almost half of our patients had at most mild fibrosis, and more than 1/4 of patients had cirrhosis. My presentation by inviting inviting you to the 18th World Federation for Ultrasound in Medicine and Biology Congress that will be held, hopefully, in Timișoara in Romania next May.